All right, so we're diving deep today into some really interesting new research on childhood caries treatments. SDF's been generating a lot of buzz lately, but this study, well, this one really caught my eye, especially when they started talking about something called SDF2.
Yeah, you're right on the money with that one. We're going to be unpacking this clinical trial, and let me tell you, it's got some pretty exciting results around this SDF2, which is, to put it simply, silver diamine fluoride, but applied twice a year instead of the usual ones. Oh, and they didn't stop there. They actually looked at this other treatment called Tiefenfluorid, compared both of them to a placebo, and even factored in, get this, behavioral counseling.
Okay, well, hold on for a second. I get that clinical trials are like the gold standard in research, but remind me again what makes them so different from other types of research.
So imagine this, you've got a clinical trial, right? And the researchers, they randomly assign these kids to different treatment groups. And by doing that, it ensures that the results aren't skewed by other factors, like some kids having, say, better dental hygiene to begin with, or maybe getting more support at home with brushing and flossing. It's about leveling the playing field so you get those nice, reliable results.
Got it. Makes total sense. So everyone in this study got behavioral counseling, but what they got in terms of fluoride treatment and how often they got it, that's what varied. What exactly were the researchers measuring, though?
Well, they were really interested in two main things. First off, how effective were these different approaches at preventing those, well, let's be honest, nobody wants to hear their kid needs a root canal, right?
Hmm.
So how well did the treatments prevent those serious dental complications? You know, the pain, the extractions, the root canals. But here's the other key thing. They also wanted to know how satisfied the kids were, and just as importantly, how satisfied their parents were with each of the treatment options.
All right, hit me with it. How'd SDF2 do? Did it live up to all the hype?
Oh, it did more than that. It absolutely crushed it. You ready for this? A 72% lower risk of those serious dental complications we talked about. Pain, extractions, you name it. All that compared to the placebo group.
72%. Okay, now that's impressive. Even I'm impressed. Was that the only surprise there, or did the researchers uncover anything else that wasn't really on their radar?
So this is where it gets really interesting. STF2, get this, it actually outperformed regular SPF, the kind that's usually just applied once a year. It's like frequency really does make a bigger difference than we thought.
So are you saying we might have been underestimating SDF all this time? I gotta be honest, when I saw that 72% figure, my first thought was for all the parents out there dreading those dentist appointments, especially if their kids had a rough experience in the past.
And that's exactly why this research is so important, you know? They didn't just stop at those clinical outcomes. They actually took the time to ask parents and kids, hey, how did you feel about the treatments? Which honestly makes a huge difference.
Okay, all right, let's hear it. So were the kids lining up for more SDF2, or were we talking like full-on meltdown mode?
Well, you'll be happy to hear this. Patient satisfaction was overwhelmingly positive. Like across the board, almost all the parents, no matter which group their child was in, they said they'd choose these non-invasive options again.
Wait, seriously? Even the placebo group?
Even the placebo group. I mean, in fairness, every child in the study did receive that behavioral counseling, right? So that probably played a role in making the whole experience more positive.
Mm.
But still, it really highlights this big shift that's happening towards less invasive dental care, and it seems like parents are 100% on board.
Makes you think, doesn't it?
Yeah.
I mean, even beyond just SDF and these specific findings, what does this tell us about where dentistry is headed in the future?
For me, it really feels like we're moving towards this more holistic, patient-centered approach. It's not just about fixing the problem anymore. It's about making the whole experience, as painless and stress-free as possible. And that goes for both the child and, of course, the parent.
It really feels like we're seeing the bigger picture now.
You got to, we've
Yeah.
been so focused on finding that one magic treatment, you know.
The quick fix.
Exactly. And we forget sometimes, there's a human on the other end of that drill.
Right.
This study, it's like a breath of fresh air, reminding us it's not just about clinical outcomes. It's about the patient experience, making sure the treatment is actually doable, in the real world.
And it seems like this study with its focus on SDF2 might have actually found something that really could change the game.
No doubt. And it raises a really interesting point, too. The COVID-19 pandemic actually made non-invasive treatments like SDF way more popular.
Really? I didn't realize that.
Yeah, dentists were looking for ways to minimize those aerosol-generating procedures, keep everyone safe.
Makes sense.
So it makes you wonder, right? Did the pandemic kind of accidentally push us towards a better way of doing things?
That's a really interesting thought. I mean, sometimes it takes something huge like a global pandemic to shake things up and make us rethink how we've always done things.
Exactly. And this could be just the start, a total paradigm shift in how we approach childhood dental care.
It's like we were all taking this one route because that's how it was always done, and then suddenly we find this shortcut, and it's like, why would we ever go back to the old way?
And for you, dear listener, this means you're armed with the knowledge to have those important conversations with your child's dentist.
Exactly. Don't be afraid to ask those questions. Is a non-invasive approach right for my child? What are the pros and cons of different treatment frequencies?
What should I expect in terms of effectiveness and just the overall experience?
Knowledge is power. And now you have the power to make those informed decisions for your child's dental health.
We hope this deep dive has been insightful for you.
Remember, this is just the beginning. Keep asking those questions, stay informed, and let's all keep working towards healthier, happier smiles.
Until next time.
Happy learning, everyone.